everyone. Welcome to the Youth Advisory Council interview series. We, the Youth Advisory Council at the Center of Youth Bipolar Disorder at CAMH, has started this series to try and raise awareness and translate knowledge from the ongoing bipolar disorder research in a way that is accessible and meaningful to patients and families. So this is the fourth interview in the series. CYBD's Youth Advisory Council, or the YAC, was established in 2021 and is composed of 6 youth advisors with bipolar disorder. The YAC team allows us the opportunity to meaningfully engage with our patients and integrate their voices towards education, stigma reduction, and advocacy efforts in the field of youth bipolar disorder. A great accomplishment of the YAC has been the creation of Never Alone, a Youth's Guide to Bipolar Disorder, which is an informative and inspirational booklet that shares first-hand narratives of youth with bipolar disorder written by youth for youth. This series is an extension of the YAC's team's efforts. Today, we have 3 youth advisors interviewing one of the CYBD researchers.
My name is Amelia, and this is my first term on the Youth Advisory Committee. I'm at Concordia for engineering, and I work at Departments.
My name is Adam. This is my second term on the Youth Advisory Committee. I work in fitness, nutrition, research, and practice, and I'm going to school to become a dietitian.
My name is Sunny, and this is my first term on the Youth Advisory Committee. I am a returning high school student, and I work at my family's Woodfire Pizza restaurant.
So today we have Diana Khoubaeva, who's a research coordinator and DBT study therapist at CYBD. She's here to talk to us about her research projects. Thank you so much for coming today, Diana.
Thank you for having me.
So Diana, what is your current role at CYBD? What does that entail, and how long have you been here for?
Yeah, so my current role is as a research coordinator and social worker. I started that role in May 2024. So what my role involves is conducting, so it's a split of research and clinical. So on the research side, I do a lot of research interviews and assessments, generally support our research studies at CYBD, do grant writing, and support lots of fun activities like this interview today. So a lot of outreach, community education, things like that. And then on the clinical side, I'll be starting as a DBT study therapist soon. So I'll be helping. Yeah.
Oh, wait, that's so exciting.
Yeah,
Congratulations.
thank you. So
We're all friends here.
yes. So I'll be DBT study therapist soon as well. So
Awesome.
That's exciting.
Congratulations. That's
Yeah.
awesome.
And I've actually been at CYBD since August 2018, where I started as a research assistant. So I just completed my master's of social work, so I transitioned into this new role this year.
Congratulations.
Thank you.
Amazing. So could you give us a brief background on your education and work background and how you got here?
Yep. So I got my honors bachelor's of science and psychology from U of T, University of Toronto, 2018. So in undergrad, I did a lot of different research assistantships. I worked at Boise, CAMH, Faculty of Social Work at U of T. So did a lot of different research assistantships as a student. And then after I finished my undergrad, I started working at CYBD almost immediately, a few months later. And while I was working at CYBD, I also did volunteering at Kids Health Phone, an organization called Shelter Movers, Bellwoods Health Services. So doing a combination of work and volunteer just to get involved in mental health care and research. And then, like I said earlier, I just finished my Master's of Social Work at the University of Toronto as well this past April, where I specialized in mental health and health. And I did my placements at Salvation Army, the Residential Treatment Center for Women. And my second year placement was at CAMH, actually, at the Borderline Personality Disorder Clinic.
Nice.
Yeah.
Amazing.
So what would you say your body of work is focused on, and how did you decide to pursue this topic of research?
Yeah, so I published papers in the lab on suicidality and self-injury in youth with bipolar disorder, eating disorders and bipolar disorder. So those 2 topics, the first one, the suicidality, I was really interested in. Right when I started working at CYBD, I started doing research assessments where I got to see, youth come in, they were seeking treatment, and it was wild and interesting to see how youth so young could experience such troubling things like suicidality and self-injury. So I was in part shocked and also really wanted to learn more about what causes these things, how common is this in youth with bipolar disorder, and also personally affected by suicidality. So combination of personal and then seeing it in work. So I really wanted to learn more about it and understand what causes it. And then eating disorders, similarly to suicidality. So as I was working on my paper on suicidality, we found out that eating disorders are associated with suicidality, youth bipolar disorder. So that was like a natural next step to further look into that topic. And then, as we'll talk about in a little bit, I led our exercise intervention study. So I was primarily responsible for doing all the research aspects of the study, and I also published on the findings of our study. So yeah.
That's really impressive.
you.
Congratulations
Thank
on
you.
just finishing.
Yes, thank you.
So we'd love to hear more about this research, and we're hoping you could break it down for us to make it more understandable. We're interested in your paper, as you mentioned. It's called You Can't Take a Pill to Exercise, Qualitative Findings from the Toward Exercise as Medicine for Adolescents with Bipolar Disorder, Team BD Study. Can you please give a brief synopsis for the paper as you would explain it to a middle school student?
So this paper is like a part 2 of our big intervention study that we did that focused on increasing exercise in youth bipolar disorder. So this was like a part 2 paper where we really focused on getting feedback from the people, from the youth who completed the study, to really understand like what did they like about the study, what did they not like, what was challenging, and how could we really improve the study going forward. So we brought them back for consultation forums, which are like very informal ways to share your feedback with, there were like usually 2 or 3 other participants all together. So we asked them about like, you know, what was helpful, what was not helpful, what could we do better in the future. And the paper was really focused on 3 main aspects. So feasibility, which is like, can we actually deliver it in our team, in our lab? So we found that it was feasible to deliver it. And then we focused on acceptability, which is like, did the participants actually like the intervention? Did they find it helpful? Was it relevant? And also like, what was the impact? Like, how did it actually impact them in their behavior and their thoughts? So that's the synopsis of the paper.
Could you expand upon what the intervention was? What was the exercise done?
Yeah. So it was a 12-week behavior change counseling intervention that was focused on really like addressing the barriers to exercising, what motivates people to exercise, and like how can you really increase people's motivation and address the barriers so that you can facilitate and make it easier for them to exercise, because we want them to exercise more.
Yeah.
Yeah.
Sure. What could be some of those barriers? What are common?
So main one I think might not be surprising is mood. So like if you're it came up for most people that depression, lack of motivation, stress, anxiety.
Which ironically exercise is good for.
Exactly. And I think anyone can relate to those barriers, you know,
Sure.
here as we'll go on.
Especially this council.
Yeah.
Oh, yeah. So, in simple terms, can you explain how exercise may affect mood and vice versa, and how individuals with bipolar disorder may experience the effects of exercise differently, so positively, negatively?
So exercise is a big research topic in and of itself. I think in the last 30 years, there's been a lot of interest on studying exercise in the context of mental health, because, you know, people have found, maybe you can think about your own experience, like when you do exercise, for most people, right after you do it, you feel like some kind of boost, positive emotion. So for exercise, you do it, you can feel like that immediate after the exercise, you know, people say runner's high after they do exercise, and it can lead to long-term improvements in your mood. So exercise can help to decrease depressed mood, increase happy mood. So this is why exercise is actually being included as a treatment recommendation, a lot of treatment guidelines. We also know that on the flip side, our mood impacts our behavior. So how we feel impacts what we do. So if you're feeling depressed, it's probably going to be hard, or not even depressed, just sad. You might not have motivation to exercise. And on the flip side, if you're feeling happier or you feel more energetic, obviously you'll probably want to exercise more. So they're all interconnected. Mood affects exercise, and exercise affects mood.
Yeah.
So, are there any unique challenges or considerations for individuals with bipolar disorder when it comes to exercise?
Yeah, so how does exercise affect people with bipolar disorder? So we actually studied this a lot before we did our exercise intervention. So we published a lot on how youth with bipolar disorder in our clinic experience exercise differently compared to those without psychiatric disorders. So In one study, we found that people with BD, youth with BD, and controls had similar changes in their emotions. Like I was mentioning earlier, they did one bout of aerobic exercise on a bike, and then we tested their emotions before and after the exercise. So we found that they actually had similar changes in their emotions, but notably, youth with bipolar disorder had a less smaller increase in their positive emotions compared to those without psychiatric disorders. So we concluded that youth with bipolar disorder may not experience the same immediate benefits, like in terms of immediate like positive emotions right after exercise. So that's a consideration that we try to integrate into our exercise intervention. In another study, we found that youth with bipolar disorder have different brain blood flow compared to youth without psychiatric disorders, and they did differently on a cognitive test. But those differences between youth with bipolar disorder and controls went away after only one session of exercise. So those differences in their brain blood flow and how they performed on a cognitive test went away after they did just one session of aerobic exercise.
Was it negative? Like youth with bipolar weren't doing as well on the cognitive tests?
Yeah, and their performance was impacted by symptoms of depression as well,
Right.
which ties into a previous question about mood and
Right.
yeah.
So, what type of exercise would you say is best for bipolar disorder, or does it even matter, the types?
So I think whatever exercise you can do consistently and regularly, that's the best. Whatever you can do consistently and stick to it, that's best. And I think for bipolar disorder, there's a consideration of the heart bipolar link. So a specific kind of exercise that can target health outcomes is aerobic exercise. So anything that gets your heart rate up and your breathing up. So running, jogging, swimming, anything like moderate intensity of exercise. Because that, when you increase your, it's called cardiorespiratory fitness, that's protective for your heart health. So because bipolar is linked to heart health, doing aerobic exercise specifically, we think is going to be most beneficial. But strength training, resistance training, whatever exercise you can do, you're going to get benefits, most likely.
Can you speak about some of the positive effects of exercise that youth with BD can experience when they do exercise?
Yeah, I think same as anyone else. So I know I mentioned earlier that youth with bipolar might experience exercise differently right after. They might not get the same positive boost, but it's all dependent on the person, right? Some people, I've met lots of different patients who they exercise all the time and they enjoy it and they love it, and then some people, they don't enjoy it. I think it goes for anyone. Like some people really love to exercise and some people don't. So yeah.
So the study is complicated and there's a lot of steps to the study. Can you speak on how youth tolerated it and whether there were any aspects of the study that were not well tolerated?
Yeah. So it was a pretty intensive study. So there was the 12 weeks of an active intervention, which involved like monthly in-person, we called them BCC sessions, so like basically therapy sessions once a month. And then participants had the option of doing weekly phone calls or texts. But it was actually a 24-week study. So we had the 12 weeks of active and then a 12-week of follow-up. So it's a pretty long study. But in general, which was promising for our, concerns about feasibility, people tolerated it well. So most people who we recruited for the study completed the study. So that shows us that people are willing to stick it out and stay the whole 24 weeks. And people who completed the study, they did all the BCC sessions that are in person. They did all the fitness tests, all the interviews. So people who stuck it out all the way through. We were very deliberate about trying to be flexible about scheduling. So people had an appointment with Dr. Goldstein or someone else in the clinic. We would try to book it like all in the same day, so they wouldn't have to come like multiple days. And we were flexible about rescheduling. So we tried to make it very adaptable. And with that being said, I think one of you asked a question about barriers in the study earlier. So there were a lot of barriers that people were honest about. So like, of course, depression, that was a challenge, motivation, anxiety, body image, those all made it harder for people to actually exercise. And some people reported that if they didn't exercise or they didn't meet their goals for that week, they would feel bad. Yeah, and I think anyone can relate to if you make a goal and you don't meet it, like you'll feel bad. But if you have to go and talk to your BCC therapist about it, that can bring up, yeah. And I think that's something that anyone can experience.
So if you don't hit a goal, if you miss what you were supposed to do for the week,
yeah,
is kind of the best thing to just look at, like, not get too down on yourself, just
Exactly.
realize what happened and progress from there.
Exactly. That was the whole point of the study, you know, understanding, because especially if you're starting out exercising, like doing no exercise, you're gonna experience a lot of barriers. I think that's normal. Like getting into a new routine, it's hard for anything. So that was the whole point of the study, you know, addressing what are the barriers, how can we increase your motivation, how can we address the barriers so that next week you could do just a little bit more.
Thank you so much.
Yeah.
So, what specific participant feedback or outcomes did you find most enlightening regarding aerobic exercise in youth with bipolar disorder?
Again, I think the piece about depression and mood and motivation, the fact that it was the most common barrier and the barrier that came up so often, I think it really hit home that this is a real barrier. And I don't know anyone who has personal experience with depression, you know, people might tell you like, oh, just get up and do it, just go and do it, but it's a real barrier. So just hearing that over and over again really solidifies that it's a real barrier to doing something that you know will benefit you, that you might feel good after doing, but it's that initial hurdle. So just really solidifying that, and that will help us to inform like our next intervention, like how can we really target the depression piece so that it's not as much of a barrier next time. And another piece that I found most enlightening for me was just how personal like exercise is for people, and how personal like barriers are, and how everything needs to be personalized so that it suits your exact needs, because everyone has different needs, everyone has different lives, different preferences for exercise, so it's all an individual journey.
I agree with that.
Yeah.
I was hearing that and I was like, very relatable.
Totally.
We're also interested in your paper, you've got a big name here, Comorbid Eating Disorders in a Sample of Youth with Bipolar Disorder, Elevated Burden of Dimensional and Categorical Psychopathology. Ooh. Can you please give me a brief synopsis of this paper and explain it in a way that's a little bit easier than that title?
Yeah, so the title is a mouthful. So the synopsis of the paper is that we wanted to examine the frequency of eating disorders in the sample, or like how often do youth with bipolar disorder experience eating disorders, and we wanted to see what factors are associated with having an eating disorder. So those are the main things we studied, and we actually found that over a quarter of our clinic sample had a history of eating disorder, and we found a lot of different characteristics that were associated with an increased likelihood of having had an eating disorder.
Did you find higher levels in female patients?
Yep.
Okay. I was just, because I find that eating disorders aren't as talked about in men, so I don't know if there was a higher percentage. Do you know the split about?
I think it was, I wish I had the paper on hand, but it was like a pretty significant split, like 70-30, like in girls versus boys, and I think that tracks with like most eating disorder research. Yeah.
Okay.
Yeah.
Mm-hmm. So eating disorders are somewhat common, like they happen, but they seem to be not studied as much as they could be.
Yeah.
Why do you think that is, to start?
Yeah, so when we were doing like the literature search on eating disorders and bipolar disorder, we found very few papers in general, but even fewer focused on youth. And it's a good question, like why is it understudied? So I think in general there's still like a stigma, or not a stigma, but there's like a some researchers think that adolescent bipolar disorder isn't real, so there's like that limits. Yeah.
We've got 1, 2, 3 things to tell you that that's not true.
Exactly. So, you know, that limits research in one way, and then most research tends to focus on like one or the other. So research tends to focus on like bipolar or eating disorders and not as much on both. And also there's challenges with diagnosing one or the other, because a lot of the symptoms can overlap and be misdiagnosed for one another.
Mm-hmm.
Yeah.
Okay. Yeah, and then so eating disorders are understudied, and I think we've heard that bipolar disorder is also understudied. So I guess this topic in general is double understudied. So it's good that you're. So why do you think that they occur frequently together?
Yeah. So there's a lot of potential reasons. I think one is just genetics. You know, there might be an underlying genetic vulnerability to both. So people who have bipolar disorder might have the same vulnerability to developing an eating disorder and vice versa. And you can also think about the environment. Like they might be triggered by the same environmental things like family, the kind of family you're born into, stress, the environment around you. And they also share some similar patterns in terms of like emotional regulation, so deficits or trouble regulating emotions is associated with both eating disorders and bipolar, and also difficulties with managing impulsivity is common for both disorders. Also, symptoms of an eating disorder might influence bipolar disorder and vice versa. And of course, medications that you take for bipolar disorder can affect your appetite and things like that. So that can also lead to troubles with eating.
Mm-hmm. So when we talk about eating disorders in this context, it can be both overeating and perhaps there could be undereating, or a little bit of both, eating
Exactly.
and storage and stuff like that.
Yeah.
So was there anorexia athletica as well, or did you do nervosa? Were you specific on bulimia, or was it kind of like eating disorder umbrella, or was there specific types you guys focused in on?
Yep, so we use the DSM-4 criteria, which is the Diagnostic and Statistical Manual, which is like the Bible of psychiatry, where like they list all the disorders. So we focused on eating disorders in total, and then under eating disorders we looked at anorexia nervosa, bulimia nervosa, and eating disorder not otherwise specified.
Okay.
So these are different than the current DSM-5 eating disorders, but similar but different.
Yes.
Yeah.
Did you find higher levels of certain types of the eating disorders within that umbrella? Did you find higher levels of bulimia or perhaps nervosa?
I think the split was bulimia, eating disorder, NOS, and then anorexia nervosa. So anorexia was the least common. I think bulimia was the most common.
So are there any like reasons why binge eating is more prevalent than any other form of eating disorder with bipolar disorder in the overall study sample?
Yeah. So as I was looking into the research on this, some hypotheses or some reasons that were given by researchers were binge eating disorder and bipolar disorder might have similar disruptions in the reward networks in your brain, so that could explain why binge eating specifically is more prevalent in bipolar disorder. Medications used to treat bipolar disorder might also lead to or influence binge eating behavior, and people with bipolar disorder might just be more vulnerable to experiencing binge eating during periods of low mood, because depression can impact your appetite and how much you eat.
Yeah, that makes a lot of sense.
Yeah.
Were there any flaws or limitations with the research process, especially since anorexia can be such like a touchy subject? Did you find kind of boundaries you were hitting with there?
Totally. So I think all research has limits
Of
and
course.
flaws. No research is perfect. So I think the main flaw was that the study design is what we call retrospective and cross-sectional, which means we looked at things that the youth have already experienced. So we looked at all their past, and we only measured them at one time point. We only looked at one time point, so when they came into the clinic. So with that, we got a lot of information, but we can't say like what caused what in what direction. So we can't say like the eating caused all these other factors, or these factors caused the eating disorder. So that's a limitation that's pretty common in these kinds of studies. And then in terms of something I mentioned earlier was that the criteria we used for eating disorders was based on the DSM-4, which is an older version. Right now it's the DSM-5 TR. So with each iteration of the DSM, there's like different people like recategorize some symptoms and they change some symptoms. So DSM-4 criteria is a bit more strict. So we think that if we use the current DSM-5 criteria, we might have a higher number, because the criteria in the DSM-5 is a bit more, it's different, it's a bit more lax.
Okay.
And then going on to your question about anorexia, so because we only had, for each subtype of eating disorder, we only had like not that many people in each subtype compared to like if we just aggregate them all together. So that way we couldn't like separately analyze like what causes anorexia, or like what factors are associated with anorexia compared to bulimia, compared to NOS. So and then last limitation is because our research relies on like a clinic sample, it's youth who come seeking treatment. It's a very specific profile of youth, so it might not be generalizable, or like it might not apply to a random kid with bipolar disorder on the street.
I see.
Yeah.
That makes sense.
How do you think your research is practically relevant for patients, either now or in the future? And so basically, how do you think this can be applied, these findings can be applied to everyday life of youth with bipolar disorder?
Yeah, so the topics I studied are topics I studied because I found them, like I saw them in the clinic when I was working with the youth and doing these assessments. So I think they're practically relevant in that this is something, obviously, as we found, it's not an uncommon struggle for youth with bipolar disorder. So I think it's practical in the sense that just seeing the number, like seeing that a quarter of our sample experiences eating disorders or has, like that can help to reduce stigma, that you're not alone in experiencing these things if you experience it. So I think research helps to destigmatize, helps you feel not alone. And then specific research like this, our aim is to really understand like what causes these things, what factors are associated with things like eating disorders, that we can really target our treatments. Something we found was like depression was elevated, like more severe depression in those with eating disorders. So we really need to obviously focus on depression to help with addressing eating disorders. So we want to use this research to really tailor treatments going forward and to reduce stigma.
Okay. So in terms of the sort of the treatment of eating disorders, are you more so treating, like feel like there's an underlying issues of like depression, something else, and then the eating disorder, or do they sort of feed off of each other, where you have the eating disorder that makes the depression worse and vice versa?
It's hard to say like what causes what, like what's chicken and the egg, but like, you know, with everything, like it fuels each other. So more severe eating can fuel more severe depression and vice versa. So with everything, every treatment, most treatments, like you're not just treating one thing. It's like you're treating a whole person and everything else that's going on with them. So understanding like what are the main factors, like what's like popping out in terms of someone with an eating disorder, what do we really need to target? I think that's the goal of this research, to help us understand what we need to target. Yeah.
For sure. I gotta ask, is there anything about exercise and eating disorders? Because to me it sounds like sometimes, I know a lot of people, I go to the gym, people will exercise so they can eat more. So in some ways it can be counterintuitive, but maybe there's some beneficial aspects of exercise for
I think with anything, like there's a limit. With anything, you gotta do stuff in moderation. You gotta understand the reasons why you're doing it. And like, while I can't give clinical advice, I think people can exercise for healthy reasons and for unhealthy reasons. And over-exercising is a criteria for eating disorders in the DSM. So it's all personal. You gotta understand like what's over-exercising for you and how does it impact your life. So they're definitely interconnected, and sometimes exercise can help people with eating disorders if done in the right way, in a safe way. Yeah.
Awesome. So did any new questions arise as a result from your research? And is this something you plan on looking into further in the future?
Yeah, so something we found interesting was we looked at the age of onset of bipolar disorder and eating disorders. So we found that most people who had an eating disorder developed their eating disorder before the bipolar disorder. So we found that interesting. So the question we have is like, how does that influence the development of bipolar disorder? And how does the age of onset of one influence the onset of another one? So that's a topic in research that people are looking into already. And like I mentioned earlier, we found that like depression, trauma, suicidality, borderline personality disorder traits were associated with a history of an eating disorder in youth. And these are all targets that can be addressed in a therapy called dialectical behavior therapy, or DBT. So, you know, having this kind of research helps us solidify that certain treatments might be most optimal or give the best bang for your buck in terms of treating someone holistically. If you can target all these things that can be addressed with DBT, then why not do it? Yeah.
So in the next steps for your research, what are you most excited and hopeful about? And why are you excited and hopeful?
Yeah. So I'm most excited to get involved in our DBT studies and actually start delivering DBTs. Yeah. Because I've been learning a lot about it, and I think it's a great treatment. It's not just applicable for people with bipolar disorder or for people with borderline. These are skills that you can use in your entire life for anyone. So I'm really excited to start actually helping people directly, not just studying what they're going through, but actually helping them with what they're going through. Yeah.
That's really nice of you.
Yeah.
At least I could do.
So why is it important to have youth with lived experience involved in the research process? And when you're, you will be delivering DBT, but do you find that perhaps you can find stuff in the DBT that can give you research ideas, perhaps?
So in terms of why involve youth in research, so research, think about research, there's a lot of moving pieces. A lot of money goes into research, a lot of time, labor. It's a very intense process. So you think about all the resources that go into research. It's like, why are we doing this? Why are we doing this research? Ultimately should be to benefit the people who, like, you're researching, who you're studying, and who will who should get the benefits of your research. So the youth who come into our studies, they share so much valuable information about themselves, and it takes a lot of vulnerability to share. To like be asked 50 dozen and one questions about everything that you've been through in your life. So because of that, like, of course we want youth to directly benefit from the time and the effort that you put into joining our research. And it really, if we didn't get youth involved in our research, like what reason would we have for waking up and going to work? Like this is our lifeblood, so of course we want people to be involved. I think it's also important to get that lived experience because, you know, researchers spend a lot of time in school and studying. They're so knowledgeable, but everyone has a bias, right? You study something for so long, 10, 20 years, like you only know that field. So you need that lived experience to really bring the soul into the research, because the lived experience, we might study it for like a few months, but you guys or people who have the lived experience, like you're going through that every day. So you just gotta bring that soul into the research.
Yeah.
Yeah. And last point on that, you know, research, my opinion is that research shouldn't just be like researchers up in our tower just like telling people what's going on. Research involves a lot of knowledge and skill building, so I think it should be a transfer of skills and knowledge from the researchers to the youth with lived experience.
Yeah.
So that, you know, one day you might want to go into research yourself, and why not start building those skills?
Yeah.
Yeah.
Absolutely.
Yeah.
It just gives that personal touch.
Exactly.
It
Yeah.
brings alive the research. That is
Exactly.
given.
Exactly. It's one thing to like see a bunch of data written down, and it's another thing when like you think about who is that person.
Shake hands with the data.
Exactly.
Yeah.
I love that. I love that. Yeah.
No, I knew that was a good line.
Yeah. It's great. Yeah.
What aspect of your work do you find most fulfilling and why? And is there a specific aspect of your research that has been particularly rewarding or has had a profound personal impact for you?
I think the most fulfilling aspect of this work is just getting to meet people like you, Youth Bipolar Disorder, in the context of research and soon clinical, and just getting to hear people's stories and meeting their families. And, you know, as much as we focus on serious topics like depression, mood disorder, suicidality, like what I find fulfilling is getting to know people in spite of whatever they're going through. So in spite of having a diagnosis of bipolar disorder, youth are so well-rounded, like hobbies, interests, goals for the future. So I find that very fulfilling, just getting to meet people, hearing their stories, and ultimately like witnessing how resilient they are, overcoming such major challenges, and contributing back to our lab the way you guys are. So I find that super, super fulfilling. And just like seeing the evolution. So we see people, they come in, sometimes it's the worst day of their life, or it's been like extremely tough for them. And then seeing people evolve over so many years, just overcoming so much and changing and just developing all these interests. So not just seeing people at their worst, but seeing how they evolve and pursue and grow up and give and contribute back. Yeah, I find that extremely fulfilling. That's what keeps me coming back.
You're talking right to us.
Yeah.
Yeah.
So for young researchers or students interested in pursuing a career in mental health like yourself, what advice would you give them?
I think number one is like looking introspectively and understanding yourself and like what are your interests? What do you like to do? What do you like to study? Especially for research. If you're going to research, you're going to spend a lot of time reading, a lot of time writing, so you better like what you do. You better like what you study, because it's not going to be easy to study something 40 hours, 50, 60 hours a week if you don't like it. So that's number one. Pick something that you like to do.
Yeah.
And then once you figure that out, start networking, start looking for people, start looking for opportunities, find a lab to work at, find a really good team, because the team makes it. No one works in research alone. As you can see, we have a whole team, so find a really good team, find a mentor who can give you advice on school, if you do a grad school, or like what educational pursuits do you need to go to meet your ultimate goal. Also, just be open-minded. So my first research positions, completely different from what I'm doing now, but keep an open mind because research skills are transferable. learning how to do basic research, you can apply those skills like writing, grant writing, talking with participants. You can apply that to any other area of research. So be open-minded. Don't feel like you have to be stuck in a silo for the rest of your life in one area of research. I think last piece with research is setbacks happen. Challenges happen in research. Research is not like mental health. Research is not linear. You have ups and you have downs. But if you are really passionate about something, really passionate about a specific area like bipolar disorder, you'll keep studying it in spite of any challenges. So take everything as a learning opportunity, any challenges and setbacks, and that's why you also need a mentor to help you manage all those challenges that come in research.
Oh yeah.
Yep.
You've got the good ones.
Yep.
Is there anything else you would like to share about your upcoming project or goals at CYBD? Is there anything related to this research into these studies? Or anything else?
So we are hoping to do round 2 of our Team BD study. So taking all the feedback, all the things that we learned from Team BD number 1, refine it for Team BD number 2. So adding in components that we learned that the participants would have liked from the feedback forums, and putting those into the next study. And also just starting as a social worker, DBT therapist. I'm very excited to start doing that.
We're so excited for you.
Yeah.
Oh, I can't wait.
Yeah, I think it really adds something being a clinician practitioner. I think it adds to your research and adds to the practice.
Totally.
The knowledge one way, and then the being able to understand the human experience on the research side. So I definitely appreciate that.
Yeah.
Thank you so much for coming.
Thank you.
Thank you for having me.
Yeah, so on behalf of us, thank you so much for your time. We've learned a lot from your insight, and we know our audience will appreciate your knowledge.
Happy to share.
Thank you.
Thank
Thank
you
you
for
so
having
much.
me. Thank you.